My name is Joyce Hollander Rodriguez. I'm a family physician in Klamath Falls, Oregon. I work at OHSU. There's been some work already on this, and so many of these things target ways of practicing that involve a very comprehensive scope of practice, that even within primary care, we already think of ourselves as generalists, that we are trying to do this whole person, whole community care. And if you look at generalists within some urban settings and some rural settings, people who are in under-resourced or rural settings often need a very broad scope of practice because they are filling in the things that you cannot refer out, or they're filling in the duties of team members that don't exist in their setting. And so we really need for people to have role models and experiences that prepare them for this broad scope of practice. And then there's particular ways of being, like how to be adaptable and change based on the needs of your community. Do you actually have the skill set to assess the needs of your community and then adapt your approach as a provider and your skill set and your scope of practice to meet the needs of your community? Because that's what it takes to actually improve health. And then thinking about, are you a resilient and reflective provider? Because your professional network, it may be small, it may be broad, but you need to be able to provide that for yourself so that your professional identity includes these ways of monitoring your own wellness, providing your own lifelong learning, getting yourself the resources you need, lots of creativity and working with others, working in these collaborative teams, but adapting to teams that may not look like they do in other settings as well. So lots of different attributes there. One of the key things that we find is the people that thrive in these settings and really flourish are people that derive a very strong sense of meaning and purpose from the work itself. So finding that alignment and finding ways to really nurture their own spirit within the work that they are doing is very important. And then also being able to have a sense of community within it so that they have support within their collaborative teams. They can be reflective about where self-assess for where they need to fill in gaps within their wellness and be able to manage and monitor that themselves. That's something that they are going to really want to be prepared for. They have mentors that will do that, people that will help guide them. And that's one of the things within Compadre that we're hoping to connect these attributes and then also that sense of community and coach people through what that looks like. What does wellness look like when you're in settings that have scarce resources and working with populations that have a very, very, great amount of need?